Me invite now the last speaker of this session, Professor Srirama Kripanidhi, to make his presentation.
Before starting the presentation, let me introduce Professor Srirama Kripanidhi. Professor Srirama Kripanidhi is a retired Dean and Head Biotechnology at Sri Satya Sai Institute of Higher Learning, Andhra Pradesh. He has a wide range of publications, research publications in the field of physiology, phylogeny, molecular biology, etc. So thank you so much, sir, for being here and I agree to participate as a guest speaker in this event. Over to you, sir. Thank you.
Good.
Good morning to you all, sirs. Many thanks for having given me an opportunity to speak in this forum on healthy aging through adult vaccination. Respected chairperson, sir, and other participants in this virtual conference. Vaccination and vaccine is not something new to us. For the past 2 centuries, you are quite familiar. There is spectacular, convincing evidences that we were having through its performance over the 2 centuries. Even then, still there are people who are hesitant of vaccine, who are reluctant of vaccine, who do not want to get vaccinated, particularly adults. And those details are going to be discussed in the following 25 slides. The purpose of this presentation is to disseminate the information on the importance and necessity of adult vaccination, to provide a few recommendations to create awareness, to elicit awareness, particularly among the senior adults. So humanity suffered through a series of disease pandemics, particularly during pre-vaccination period. In this context, I wish to bring to the notice of you all that a Nobel laureate in the year 2022, Benes Fanti Pabu, has described the evolution of human beings. While he was describing this, he made a mention about Denisovians. Humans and Denisovians lived together. There was gene flow between them, but the Denisovians have become extinct. Humans are now continuing extinct. Why did Denisovians become extinct? That is recent, that is around 30,000 years back. There was no, what is it called, attributable environmental calamities. So the possible reason is host-specific parasite infections made these Denisovians to become extinct. Like this, humanity also is now suffering the specific infections. As you see here, within the span of 5 years, this plague, Black Death, made 50 million people die in European population. 60% of Europeans have died. The rest of the world, we were not having the data. And in a matter of 100 years, Columbian exchange. Because of this, there is nearly 90% of Native Americans lost their lives. If you go through the timeline here, in India, for about nearly 60 years, 23 million people died because of the cholera. Recently, Bharat Biotech has taken up to manufacture kill coal. This, what is it called, the cholera vaccine. Later, there was Russian flu, there was a plague that also took a good amount of this death toll. Apart from that, there was smallpox that also took more number of people. In addition to this, very devastating thing, within the span of 2 years, between 1918 and 1920, 100 million people died because of the Spanish flu. In this timeline, if you go through, starting from 1970 up to 2020, we're almost safe because vaccines are prevailing. And suddenly in 2019-20, there was an eruption of COVID-19 within the matter of 18 months to 24 months, the 27 people died. So here the problem is that we have to understand vaccines are really saving the people, particularly the aged people. So the content of my presentation goes like this. United Nations Decade of Healthy Aging concept due to increase in elderly population, related illness and remedial measures, decline in immune response upon aging, barriers in adult vaccination, programmed adult vaccination, upkeep the health even in the late age. So we have gone through plenty of talks earlier, wherein the socialization, wherein the digital medicine, wherein the technical talk about the type 2 diabetes were given. Here, this is all about the prophylactic measures, preventive measures, prophylactic measures. If we take this, the senior adults maintain happy life. So aging world population. By 2050, it is anticipated that globally there will be 2 individuals above 65 years of age for every child aged less than 5 years. A similar trend is expected in India, where the proportion of elderly population is anticipated to increase from 8% in 2015 to 19% by 2050. That means if Indian population is 150 crores by 2050, as of now it is 130 crores, 150 crores by 2050, 90% comes to approximately 28 crores of senior adults. There's almost equal to South Indian population of today. Possible reasons for the onset of the concept of healthy aging. The elderly population is more susceptible to infectious diseases due to age-related decline in their immunity. That's what called immunosenescence. We're going to see in the next few slides. Moreover, the presence of one or more comorbid conditions in the elderly, such as cardiovascular diseases, is common. Pulmonary disorders is also we are seeing. Diabetes mellitus, as explained previous speaker, neurodegenerative disorders and chronic kidney diseases render them more vulnerable to infectious diseases. Thus, the anticipated increase in the proportion of the global aged individuals with their possible illness must have been prompted to introduce the concept of a decade of healthy aging by the United Nations. The World Health Organization recognizes that vaccination at various stages in individual life is a significant component to upkeep his health. So these are the action areas of United Nations Decade of Healthy Aging, combating ageism. The first speaker has spoken well about the social aspects, how to contemplate and how we think, feel, and act towards aging. The integrated care primary health services, with which I am now focusing about the prophylactic treatment, particularly having vaccination, and long-term care and age-friendly environment that is fostering the older people, taking their skills into consideration. Now, the second aspect of the presentation is decline in immune response upon aging. So if any pathogen, if any bug infects us, we'll be having both innate immunity and adaptive immunity. This innate immunity kills these cells and then communicate to the adaptive immunity cells. That's what the lymphocytes. And these lymphocytes maintain the memory. These are all the clone of cells. These clone of cells, either B or T cells, are in relation to the pathogen. In future, if this individual gets infected, this clone of cells see that the infection will not be serious. So like this immune response goes, it needs to be explained to the adults that vaccination sees that the clone of cells will be developed in our system. So that is, a vaccine is a biological preparation that improves immunity against a specific infectious disease. Again, a vaccine leads to the development of a clone of memory cells, which makes vaccinated individual to protect from recurrent infection. The term vaccines and vaccinations are derived from variable, that is variole vaccinate, coined by Edward Jenner. Life history of Edward Jenner can be gone through in this website. So now let us see a few more slides on immunosenescence, the master immune cell. So the T cell means the cells which are developing from the thymus, they are called the T cells. Like that, we have got more than 100 types of cells in our body. So the T cell is said to be the master. Master means this undergoes a sort of schooling or education so that the T cell knows what is self. It knows only what is self. If anything is non-self means it attacks. So that is its nature. So as the age progresses, the thymus gets atrophied, and as a result, there will be reduced production of T cells, reduced production of TCR, that is T cell receptor complex, so that we'll face a situation called senescence-associated secretory phenotype. Apart from that, in the thymus, there is a positive selection, negative selection. So positive selection means they will attack non-self cells. Negative selections means they will be eliminated. So there is sometimes impaired negative selection of thymocytes. They will see that self-reactive cells, T cells, they will attack our own system, our own organs. As a result, we develop chronic inflammation and inflammation. So this is what senescence-associated secretory phenotype, wherein aging, as the age progresses, senescence induction comes. Once the senescence induction is initiated, there are senescent cells. These senescent cells get accumulated in the body. As a result, there will be inflammation, which makes the tissues to get damaged and immune system to get lowered in its function. So this is another interesting aspect. This also need to be told to the adults in our India, so that they'll be prompted to have the vaccination. Decline in immune competence and immune response among elders, and revitalization due to adult vaccination. Immune competence means the potential of an individual to fight with the pathogen or infection and eliminate this infection. Immune response means activation of immune cells and cascade of events after activation to eliminate this pathogen. So this is the two differences between immune competence and immune response. So let us see this example here. So as we keep vaccinated here, so the immune response keep increasing, and this immune response after 50 years of age lowers down. So as a result, he is going to become immune senescent. Once he gets vaccinated at 50 years of age or so, then immune response again revitalize. So like this, immune competence. So the immune competence during the younger infant age and the younger adults age, it will be fine. As we keep progressing with the age, immune competence, that is our potential to fight the pathogen, gets decreased. It is decreased in such a way that the, what is this? Where is cursor? It is decreased in such a way that the risk of infectious disease, the risk of infectious diseases keep increasing. If you take vaccinated at about 50 years, then the risk of infectious diseases gets lower, risk is lower. So that's what this needs to be elaborated to the adults who are adamant towards the vaccination. So this is again a hypothetical representation where illness index with progressive age due to vaccination. If there is no vaccination taken, then the illness index keep increasing. If childhood vaccination is taken, this particular individual is protected up to 30 years, up to 40 years very neatly, even up to 50 years. Then his illness index is on par with the non-vaccinated individual. So if at the age of 50, as it is shown the mark here, if he takes the vaccinations, then his illness index will be reduced and there will be lessening of the disease burden, even at the family, even at the nation level. Let us see a few examples citing the adult vaccination that reduces disease burden. So in a country like China, there is about 20 years data that is collected, wherein hepatitis B surface antigen is given, and there are 28 million people prevented from hepatitis infection and 5 million people prevented from death. So that is the advantage of the adult vaccination. And in UK, about 5 years of study, adult vaccination declined, 37% declined in hospitalization. That is, the rush towards hospital got reduced. The hospitals are not crowded here. And 7.5% decline in public health nursing consultation. And 1 year of study in USA about influenza made 1 lakh people prevented from hospitalization. That constitute about 21% of all hospitalizations, and 7,100 people reduced influenza-related deaths. So this is a few examples that the adult vaccination decreases the disease burden. Next, let us go to the barriers in adult vaccination. So who will influence people about their adamancy, about their vaccine hesitancy? personal physician will be having good impact, 69%. Members of the family will be having good, relatively good impact, and celebrities and public figures. Let us see a few adamant responses from the people. What if I am not vaccinated? I do not want chemicals injected into my body. This is what the responses come from the adults if at all ask them to take the vaccine. I suffer from illness if I get vaccinated. I always get the flu when I get the flu shot. That's what my son was also telling in USA. I'm healthy. I do not want it. I don't need it. My ancestors have not taken the vaccine. Why should I? Let my neighbors be vaccinated. I think later for myself. Like this, adamant responses keep coming from the people. So barriers in adult vaccination, lack of awareness. The awareness about adult vaccination is poor in India, despite the heavy disease burden. A survey revealed that globally 80% of adults are unaware of adult vaccination schedule. Over 2/3 of Indian population, that is around 74.5% are adults that constitute 97 crores out of this 130 crores of the present population above 15 years, of which 2/3 means 64 crores of the people in India are totally not aware of adult vaccination. Do not know. Out of these participants who are there in this conference, are you aware that you need to have to take a vaccine? And they all under the concern that the vaccine is only for the children. Particularly lack of dedicated adult vaccination centers in hospitals. None of the hospitals in India is having dedicated vaccination center. So as I was telling to you, there's spectacular convincing evidence. That's what created for the past 70 years. These are all vaccine preventable diseases, and there is performance is excellent, above 90%, 100%. And adult vaccination rates is poor, as it's mentioned. See, even this is all about the USA data, not Indian data. Healthcare workers, we do not have the Indian data. I had to approach some of the experts in this symposium to collect the data from the adults. That I will do after this. And healthcare workers, the coverage is only 66.9%, even among the healthcare workers. Healthcare workers are supposed to have 100% coverage of the vaccine. They're having this much, even in USA. And even human papilloma virus vaccine for ladies to be taken, girls to be taken, is also very less. It leads to if it is not taken, cervical cancer, it leads to cervical cancer. Need for adult vaccination. Infectious diseases affect more those of the individual's weakened immune response. And currently 6.6% of the Indian population is above 65 years of age, that constitute 9 crores. The size of this population is continuously increasing. Vaccination has been used successfully in the prevention of the diseases, as it is shown in the previous slides, besides protecting senior individuals from health hazards. Vaccination also decreases healthcare utilization, such as hospitalization and nursing. Like this, the burden on the part of the nation also gets reduced and preserves economic productivity. Hence, it is of utmost importance to promote adequate adult vaccination in developing countries like India. So there are good many platforms how the vaccination is doing, is live attenuated, inactivated, subunit, toxoid, conjugate, recombinant. So these 6 vaccines are quite popular. Several companies are manufacturing. Only the DNA vaccine, the mRNA vaccine has come during this COVID-19. mRNA vaccine has been invented by Katalin Karikó. She was given the Nobel Prize this year. It is not only prophylactic, it will become therapeutic for cancer treatment hereafter. So vaccines for the adults are going to be, and next generation vaccines are coming up by increasing the adjuvant proportions. Adjuvants means they potentiate the immune response, particularly Th2 cells. So there will be next generation vaccines for elderly are coming up. So now let us see the programmed adult vaccination, which upkeeps the health even in the late age. Benefits, we have seen the benefit. Let us see. Vaccination is a basic health intervention to prevent communicable diseases, namely pneumococcal pneumonia and invasive pneumococcal diseases in adults. Even among us who is there, please take this pneumococcal vaccine, which prevents the blood infections, bacteremia, and meningitis, that is brain cell infections. Vaccination is in the elderly attenuates the disease severity and ameliorates the complications due to comorbidities. A study demonstrated that both influenza and pneumococcal vaccines resulted in a 50% reduction in myocardial infarction. The incidence of pneumonia is 3 to 9-fold in patients with cardiovascular disease. alone, which can be avoided by vaccination. Similarly, herpes zoster is associated with an increased risk of stroke, which can be evaded through the effective vaccine. All these statements are not mine. They're all from the literature, and I'm now present before you to convince you that adult vaccination is essential. So this adult immunization schedule from Center for Disease Control, Atlanta, USA, and they have promoted this. So influenza vaccine to be taken 1 dose annually, even after 65 years. And DTaP, tetanus, diphtheria, pertussis vaccine also to be taken after the age of 60, 65 years. And zoster vaccine, human papilloma virus vaccine is only up to 26 years. Like this pneumococcal polysaccharide vaccine, 1 dose after 65 years. Okay, so like this hepatitis B vaccine is also to be taken to avoid from the jaundice. So not only CDC Atlanta, even our Indian National Health Mission under Universal Immunization Program, they have got the same recommendations, but it is to be implemented. So now this is what my main interest is to bring to the notice of you all and the elders in the conference. Proactive steps advised for the promotion of adult vaccination. Set up mobile vaccination camps in advance, family doctors to initiate with their respective patients, SMS from the medical professionals and healthcare workers, app-based reminders, a great way to remind elders on the value of vaccination. Introduce a course on healthy aging in the general science subject in the school so that it gives a sort of imprinting among the children. Promotion through social media, start dedicated adult vaccination centers in all hospitals, recruit adult healthcare volunteers with pamphlets in the regional languages, weekly report in national and regional newspapers on the progress of adult vaccination. If these proactive steps are taken, we'll be having healthy adults and we'll be having less disease burden in the nation. So Indian mythology also reminds that cattle farming keeps us away from smallpox. Cowherd boy Lord Krishna saved his devotees through passive immunization as they were allowed to dwell with the cattle. And even Edward Jenner invented vaccine from mild cowpox pustule to cure wild smallpox. And through Edward Jenner, now the humanity is saved. Summary of my presentation, I come to the fag end. A decade of healthy aging is directed by United Nations due to the increase in the number of older people in the population. Their ill health and consequent measures to be taken are highlighted. The onset of immunosenescence as the age progresses is shown. The benefits of adult vaccinations are reduction in myocardial infarction, reduction in hospitalization, reduction in nursing, and reduction in infection due to vaccine preventable diseases, availability of elders to assist and guide the family and community. Recommendations for promotional aspects are shown. Thank you. So I acknowledge online resources, public domains for the use of the content to develop this presentation for the dissemination of knowledge. Thank you all.
Thank you, Professor Kripanidhi, for that interesting presentation and also very convincing presentation, the need for adult vaccination in our country.